Hey, good evening, everybody. My name is Dr. Nathan Thompson with the Wellness Way Yorkville. Thank you guys so much for joining this broadcast as well, streaming right now to YouTube, to Rumble, and also, I think, to one of our Facebook pages, but not all of them. So we'll make sure that we go and repost this to there to Exemplify Health Center, the Wellness Way Yorkville, and then also to Dr. Nathan Thompson on Facebook. We're streaming also to Instagram as well. A lot of people are joining in. The title of today is Help! I lost my gallbladder. Here's what to do right now. So pay attention to this. If your doctor said, oh, we'll just take out your gallbladder, it's an organ that you don't need, and they left you with no direction. And I'm going to explain why that can be catastrophic when it comes to your gastrointestinal health, especially. And I'm going to give you some direction as far as what you need to do in order to help with that, especially. Okay. What's so amazing is when I see people who get their gallbladder out, and I ask them this question: hey, does your doctor ever put you on a bile acid replacement? Do they even recommend like pancreatic enzymes, digestive enzymes? They're like, nope. And I'm like, huh, that's interesting. I wonder why they didn't do it. And that's just because they're there to put out a fire. They're not there in order to build health or do anything like that. So if you've lost your gallbladder, I'm going to explain to you why that happened. I'm also going to explain to you, here's the steps that you need to take in order to help your gastrointestinal system, especially. And if you are watching right now, make sure that you please say hello. Let me know where you're watching from as well. But tonight is going to be, I may get a little bit sassy. I don't know that. So if you got children, I may say a couple of swear words. I don't know. I may get really passionate, especially when I go over a couple of things, especially. So let's get into it. Okay. Help for if you have lost your gallbladder. Now, guys, the biggest thing that I would tell you is this: is get to the inflammation talk. Our next one is tomorrow, which is Tuesday night, in-person event at the Wellness Way Yorkville at 6:00 p.m. And we're going to talk about inflammation, which is what losing your gallbladder can lead to: massive, massive gastrointestinal inflammation. It can change skin. It can lead to other things. That's why we know this with looking at the Swiss watch principle. But if you're having problems with weight loss resistance, cancer, problems with infertility, thyroid disease. I just reached out to someone on Instagram who was just riddled with thyroid issues. She's like, I don't even know where to go. And I was like, I have to reach out to you because it just saddens me to see people suffer when they don't have to, especially. Even if you're talking about arthritis, type 2 diabetes, autoimmune conditions, hormone issues, things like that, all of it is linked to inflammation. Remember this: hormones make you feel lousy. They're not the reason why you're sick, though. You know what's so interesting is hormones may influence your behavior, or they may bend you towards acting a certain way, but they're not forcing you to be an a-hole. You still have a choice because you're a human. You have a choice in the matter. However, certain things and being ill and being sick can influence hormones, can bend you in certain directions as well. So make sure, guys, if you haven't, go to the top of the page. You can register for that inflammation event. It still has some time. We do have some room. That's tomorrow at 6:00 p.m. at Exemplify Health Center. At 6:00. And yes, this is an in-person event. So please don't be from Australia registering for an event unless you plan on flying and spending some time with us as well. Now, have no fear, but we do have a webinar option too. And so if you are within the contiguous 48 states, so that is going to be, within the contiguous 48 states minus Hawaii and minus Alaska, only because it's really hard. And yes, there actually now is a Wellness Way that's going to be in Maui, just as an FYI, that's be opening very soon. And so you can watch our webinar, and I see people every day get registered for that webinar. And if you follow it all the way to the end, you'll see that there is a link to get scheduled for a discovery call with me. So that's me on the phone with you. And I'll take a look prior to that. If you follow it all the way through from the webinar, you'll have a chance to be able to schedule it, and then also be able to send your lab so I can look at it prior and say, hey, you know what? It may be incomplete. Please, let's look a little bit deeper and do this. And so it's a great experience for you. And in fact, I'll give you an example of that right now. Okay. Now, in just a second, I'll actually go over it. But coming up in March, we have a new challenge. We've had a challenge coming up, I think, in December. We had a challenge in January. And And then in March, we took a month off. In March, we have a You Don't Know Squat challenge. So you will see we're going to teach you how to develop awesome mobility. Okay. Awesome mobility, and help you to get into a squat position. So the video is actually already posted to the top of our platforms. You can see it on YouTube. You can see it as it's been posted on Rumble. It's also on Instagram. You'll see that. And that will go through. Here's what I want you to do. Here's what I want you to order as far as some equipment. And here's what I want you to do on a daily basis. A lot of people don't realize is that there's no quick fix. You have to do things consistently. Consistency is king, and consistency is how you beat health challenges, because consistency is what is needed. That's what I tell people is if you consistently do the simple things over and over again, eventually you're going to win. So we have that on there. And we also have an awesome squat t-shirt as well. And I don't know, maybe it offends people. I'm like, I don't care. It's called You Don't Know Squat, and you should be able to hold a squat position for minutes at a time. And if you can't do that, we'll show you how to improve your mobility to get into that position. It's really going to be an awesome event. I can't wait to see how people improve through that. Okay. So, and in fact, I had a doctor reach out to me who follows me, and this is a younger person, like in their late 20s. And he texted me and he said, "Hey, Dr. Nate, I did your squat mobility challenge. I spent like 12 minutes doing some of the mobility and I feel absolutely phenomenal this morning. Thank you so much." And this is someone who's actually young, probably does a lot of sitting, as well. And I was like, awesome. Thank you for doing that. Dr. Thor is his name. I said, keep crushing it. I know he's doing amazing in California right now. Absolutely just crushing it, new in practice, and whatnot. And you can see if you're following it online on YouTube or Rumble, you can see how to reinforce that squat position. That's a pretty doggone good looking squat. All right. If I do say so myself, but it took a lot of work. That's why I'm proud of it, is it took a lot of work, and it also took a lot of consistency. This is years in the making, and it just doesn't happen overnight. But if you consistently do something, we use a principle known as SAID, specific adaptation to imposed demands, and it will cause your body to adapt. Okay. So if you go to the top of the page, you'll see that video pinned to the top, and watch it, order the things that you need. As far as some things, you can order it easily on Amazon, and it can be at your doorstep by the end of the week. And we're not making any money from it. I just want you to go order a foam roller. I want you to order an 18 to 26 pound kettlebell. It's in the video. Order a wobble cushion, and just start doing those things in order to start stimulating better movement. Okay. Now, getting back to remote consults and things like that, I had a gentleman who had reached out to me. They watched the inflammation webinar, and then they're like, you know what? I need to do something. And so they scheduled a discovery call with me, and we had people fill out some things so I get a little bit better understanding of what's going on. And I always say this, that if someone is deaf, blind, and dumb, not dumb intellectually, but they can't speak, I would probably be able to figure out what's going on. Why? Because we test things deeper. And some of the issues that he had going on were being overweight, significant food allergies. He would eat some foods and just break out in hives. He also had eczema, which is a big thing because people who have eczema also have a lot of food allergies as well. And it's an immune trigger at the skin that's causing the reaction, or it's an immune trigger of the gastrointestinal system that's causing a reaction somewhere else. Had significant eczema. Also had been diagnosed with a fatty liver, even at 38 years of age, and sleep apnea. So he was also wearing a CPAP machine. Okay. So, and I was talking to him, and one of the questions that prompted me to ask them was this. As I asked him this, I said, "Hey, when did the problem start?" And he said, "You know what? They started about 10 years ago." And then I said, "Well, what happened 10 years ago?" And you know what he said? "I had my gallbladder removed." And a lot of these issues happen when they removed his gallbladder. "But Dr. Nate, I have gallstones." I'm like, "Yeah." And I'm going to show you that not if someone's got gallstones, the doctor's like, "Oh, we'll just yank it out." Not every case of gallstones leads to like a bile duct obstruction, pancreatitis, or things like that. It's actually a very, very small percentage. And so he said, weight, food allergies, eczema, fatty liver, sleep apnea. Well, he had had his gallbladder out 10 years ago, and things just continually got worse and worse and worse. So help, Dr. Nate, I lost my gallbladder. Here's what you can do right now, okay? I want to take you guys to the National Institutes of Health, National Library of Medicine. And here's what they say about cholecystectomy, or the removal of the gallbladder, okay? Now, they say this. Approximately 20 million people in the United States have gallstones. Of these people, there are approximately 300,000 cholecystectomies or gallbladder removals, 300,000 performed every single year. It's the surgery that's performed the most in the United States is removal of the gallbladder. Why do doctors just want to take it out all the time? The reason is because they don't understand the function of it. That's why they used to say, yank the tonsils out. Now we know that there's a reason why someone needs their tonsils and their adenoids. Oh, but my adenoids are swollen. My tonsils are swollen. There's a reason why they're swollen. It means that they're inflamed and they're very irritated. And so 300,000 cholecystectomies are performed. Now listen to this. 10% to 15% of the population has asymptomatic gallstones. Of those, 20% are symptomatic. So the fact that you have gallstones doesn't necessarily mean that they're going to cause symptoms, but it does mean that there's a problem that's going on. Okay. So this is a surgery that's performed 300,000 times, and it's a laparoscopic surgery. So I love when they talk about, hey, look at us. We can put the fire out better. Don't you guys see that about advancements in medicine? And all they're talking about is we can put the fire out better than ever before, because it used to be an open procedure, and now they're just using a couple of holes in order to be able to remove the gallbladder. And so basically they're just bragging about, hey, we can put the fire out so much better. But I'm asking the question, why is there a fire in the first place? Why on earth was there a fire in the first place? So when you talk about the gallbladder, the first thing you have to understand is what does the gallbladder do? What does the gallbladder even do? Because talk to doctors and they're like, you really just don't need it. And I'm like, you don't understand it. And I want you to think of this. Every organ in your body is needed. Yes, including the appendix. And I've even talked about common organs that have been removed that you need, and here's why. And just because doctors don't know the purpose of it doesn't necessarily mean that you don't need it, okay? So what does the gallbladder do? Well, the gallbladder is actually a sensory organ, okay? Because it stores and concentrates bile, and it's a sensory organ, meaning it will receive a hormone response to know exactly how much to contract and how much bile to release. And a lot of it is based on how much fat is going to be in your diet. So the gallbladder really is a sensory organ because it's responding to a hormone response that's coming out, and it's what you need in order to release normal bile is a hormone response, okay? You need that hormone response. So the gallbladder is not something, just because we don't fully understand it, is not something that's like, oh, we can just take it out and no problems. But that's to understand, what does bile do? So the gallbladder actually stores and concentrates bile. What makes bile? Your liver. So what does bile do? Bile helps you to break down and emulsify your fats and shuttle it across the gastrointestinal barrier. So it's absolutely needed in order to break down the fats, okay? It is needed to break down the fats. That's why bile is so important. What's also important is you need bile in order for proper fat-soluble vitamin absorption, which is going to be vitamin A, D, E, and K. That's why when we look at people who've had their gallbladder out and they haven't been doing anything, many times we'll see that they're just pitifully vitamin D deficient. You also need vitamin A, guys, which is hugely important as far as skin health and things like that. But you also need bile in order for that to happen. So bile is 100% needed. Now, here's an interesting fact, okay? Here's an interesting fact. We call it a Swiss watch fact. This comes from Guyton and Hall's Medical Textbook of Physiology. You know what I hate about education is they teach memorization without application. They just teach you. In fact, they even taught us, just memorize this for boards. And so you just memorize this, but you don't understand the physiology of it. So many people, they just memorize physiology only to forget it because there's no context that it's learned in. Guyton and Hall's Textbook of Medical Physiology, the 13th edition, which every doctor reads or at least memorizes useless things that they have no context in, which is why they've forgotten it a year down the road after they've taken their boards. But bile secretion is dependent on proper stomach acid. Let me say that again. Bile secretion from the gallbladder is dependent on having proper stomach acid. If you're low in stomach acid, you are going to have a problem with bile acids getting released from the gallbladder. And the reason why is if you understand physiology, with proper stomach acid, you're going to have the release of secretin from the duodenum, which is the next phase in your digestive process after the stomach. And then you also are going to have bicarbonate that comes from the pancreas. And that bicarbonate is there in order to lower the acid within what's coming out of the stomach. And all of those things are needed in order to signal the squeezing of the gallbladder in order to release exactly the right amount of bile. That's the thing. If you've gotten your gallbladder out, it's like it's really tough. You don't have the sensory organ anymore. And so you can't store the bile, which means you're going to have to take it exogenously. And that's tough because sometimes you might need one capsule, sometimes you need two. And that's all going to be dependent on how much fat that you're actually consuming. Pay attention because I'm going to show you a new lawsuit that's coming down the pike when it comes to Ozempic, Wegovy, and gallstones. Okay, this is going to be really interesting. So bile secretion is dependent on stomach acid. And what's the number one cause of having low stomach acid? It's actually stress. It's stress. It's mental stress. If you have a bear chasing you, you're not going to have a lot of stomach acid, especially. So that's why stomach acid is so important, especially. So I want you to think about this. Who loses their gallbladder? Well, we were taught in school about the 5 Fs. They learn this everywhere. The 5 Fs, and what are they? Who is most likely to lose their gallbladder? And it's a female of fair complexion who's fat, fertile, and 40 or older. Don't yell at me because I said fat. That's just how we learned it. That's the mnemonic that we learned, okay? So female, fair complexion, carrying a lot of body fat, I should say, and still having a menstrual cycle and being 40 or over, okay? Now, here's what's so interesting is that, yes, this does affect women more than it affects men. So I want you to think about it. What's the biggest difference between men and women? Has to do with their hormones. And I want you to think, what influences their hormones? Being fertile, high fat distribution will cause a lot of estradiol production. So a lot of this has to do with hormones and hormone metabolism, especially. So much more likely to lose your gallbladder if you're a woman and have white skin and being overweight, carrying a lot of body fat percentage, still having a menstrual cycle, yet still being 40 or over. And that's just because you carry a lot of oxidative damage with you, especially if you haven't been taking care of yourself. This is going to interest you especially, okay? This is something that's interesting. This is going to interest you. But this comes from February 3rd, 2024, which is just a couple of less than 2 weeks ago, basically. And the title of it is called Ozempic Gallstone Lawsuit. Okay. February 2024 update. Okay. Now you're starting to see with people taking Ozempic because I want to lose weight. And I've done lives on this. I'm going to show you in just a second. I've done lives. I'm like, this is just a bad idea. Of why, but now they're realizing is that what they didn't tell you is they thought all your problems would go away if you just did Ozempic. But now one of the things that they're finding is that a lot of people are developing gallstones as a result. So Ozempic, an injectable medication that is also sold under the names Wegovy and Rybelsus, has been marketed to type 2 diabetics in a way to reduce their blood sugar levels. They actually found, because of the side effect of helping people to lose weight, Ozempic, the brand name for the chemical compound semaglutide, has also been used by some to achieve weight loss. Okay. Unfortunately, new reports reveal that some Ozempic users are experiencing severe gallbladder issues after receiving the drug. The makers of Ozempic have been accused of failing to provide an accurate warning label for their product. Okay. So now they're getting sued because of this. And if you are on any kind of social media, particularly on TikTok, you're going to see people touting how amazing semaglutide is, Wegovy, Manjaro, like all of these things. And they're not going to talk about gallbladder issues, but now we're starting to see the lawsuits start to come in because the manufacturers of this didn't warn people that there is going to be a likelihood of gallstones and things like that. So I'm going to ask you a question, okay? I'm going to ask you a question. This is why I might get a little bit riled up, okay? If a drug is anticipated to become a cash cow, will they withhold the known side effects? Let me ask that question again. If a drug is anticipated to become a cash cow, by the way, look how much it costs semaglutide monthly if you're currently getting. It is in the many hundreds of dollars every single month, many hundreds of dollars. By the way, it's a drug that you got to be on for the rest of your life. So if a drug is anticipated to become a cash cow, will they withhold the known side effects? You know what the answer is? 100% yes, absolutely. I'm going to give you an example. You guys ever heard of Vioxx, Bextra, and Celebrex? Did you ever hear about that? Vioxx, they estimated, killed hundreds of thousands of people with heart attacks. And in fact, a little while ago, Pfizer, who is a habitual offender, by the way, even recently, they're a habitual offender. Terrible, terrible. They paid a $2.3 billion settlement for illegal marketing. And what was this for? They agreed to pay $2.3 billion to settle a civil and criminal allegations that had illegally marketed its painkiller known as Bextra, which now has been withdrawn, okay? Vioxx, Bextra, you even have some people that are still on Celebrex. And it was Pfizer's forced settlement over illegal marketing activities since 2002. So basically, from 2002 to 2009, they got hit 4 times for illegal marketing, and they got hit with a penalty or with a fine. Let me ask you a question. You know why I think this is absolute bullshit? Is because when they withhold evidence that this can cause an excessive amount of deaths, they just get fined and they pay the fine out of the profits of their drugs. So they make a load of money off of the drugs, and they pay the settlement from the money that they made from the actually illegally marketing that drug. Can you believe that? So instead of grandpa having any kind of vindication for grandpa dying, they just pay a fine out of their cash cow profits. So this is America right here. And this is why this is absolute BS. This is absolute BS, because now you can lose a life and you just pay a fine versus things that are much, much deeper. And I've actually talked about these new weight loss drugs. So I have a video that I did, about that. And it's about 45 minutes long, but I talk about it. And if you go to my YouTube page and you go up on live and you click up live, you will see that on the playlist, and you will see that you can watch that video, which I did. This was approximately maybe about 9 months ago as well. And I break it down from you from a scientific perspective. Okay. And this is why people are like, oh, I'm losing weight. And I'm like, I could cut off my arm and cut off my leg and I would lose weight. But at what cost is it actually coming from? So going back to who loses their gallbladder: female, fair complexion, carrying excess of body weight, being fertile, 40 or older. And I even see in the comments, yeah, but are there outliers? Of course there are. There's outliers with everything. But the biggest thing, the difference between those two is what caused it had to do with the biggest things is fatty liver and gallbladder stasis. Okay. What I mean by stasis, the inability of the gallbladder to be able to contract. And if that bile just stays there, it will start to precipitate out stones, which is why you need a gallbladder that moves adequately in order to be able to squeeze that bile out, especially. Can you also have some hormone metabolism issue? The answer is yes, 100%, which is why you will see it after pregnancy happen more often too. The other thing is you got to make sure that you're taking care of the liver. You also have to make sure that you also have healthy digestion, meaning enough stomach acid. You're keeping things moving through, especially. So here's some symptoms after gallbladder removal. Diarrhea or loose stool, okay? dry skin. Why? Because you don't absorb fats the way that you're supposed to. Vitamin A, D, E, and K deficiency. Why? Because you need that bile. You need large amounts of bile in order to shuttle the nutrients that are in the fat, to shuttle them across the gastrointestinal barrier. And yes, you can also develop things like small intestinal bacterial overgrowth. I'll explain that in just a second. Here's a stool test, and you know where I'm going with this is I will test a stool test with almost everybody that's got their gallbladder removed, and I see very similar things that are going on. So and I'm going to show you why there's diarrhea, loose stool, dry skin, vitamin A, D, E, K deficiency, and also SIBO, small intestinal bacterial overgrowth. So here is a stool test. Here's a woman who had their gallbladder out, who had a lot of pain, inability to be able to lose weight, type 2 diabetes that's going on, could not lose weight. Now she's actually has lost like 30 pounds, and I've never even talked to her about losing weight as well. So I want you to think, if you look at this now, here's the interesting thing. She was also on 30 supplements. 30 supplements. And I looked at this, I'm like, why are you on this? Like, because I read that it was good for me. And it wasn't working, because this is her stool test being on 30 supplements. You can see, looking at here, high amounts of fecal fats in her stool, meaning she's not absorbing fats. You can also see that she's got high amounts of pathogenic bacteria or yeast. You can see that she has very low short chain fatty acids. What do you need? You need fiber, and you also need a healthy microbiome in order for that to happen. You can see is pathogenic bacteria and high amounts of yeast as well. Now, here's another person who had their gallbladder out, and this was about 10 years before, and they said, you know what? I had my gallbladder out, and I went 4 months without having a bowel movement. Is that bad? It's like, yes, that's bad. You should poop every day. I'm going to post that next on Instagram, that you should poop every single day. So if you look, you can see here when we tested it, had a really hard time with a lot of bloating, and had a really hard time with being able to move her bowels, high amounts of fecal fats, high inflammation around the gastrointestinal barrier. And you can see a lot of overgrowth that's taking place. A lot of it was killed off. A lot of the microbiome was actually killed off. And you can see that a lot of what was happening has to do with proper bile acid secretion that waters the microbiome. This is why people say, probiotics, should I be on them? I'm like, well, how is it getting watered? It's like me asking the question, hey, should I plant some grass seed here? And I'm like, if you're planting on concrete, probably not. Doesn't matter how great it is. It's just not going to grow. It's not the right soil. And this is her retest that we did. This was a couple of months later. And you can see that her absorption was so much better. You can see her inflammation actually going down, the infection going down as well. And she went from, if you look at this, 21 down to 9. So the numbers went from 21 down to 9, and she started feeling a whole heck of a lot better. And this is not even her being perfect by any stretch of the imagination as well. So it's the right testing, and it's also knowing where to go with it. Okay. Now let me ask you guys a question. If you had your gallbladder out, did your doctor tell you to go on some kind of bile acid replacement? Did they tell you to go on a bile acid replacement? I've never seen a doctor tell someone to go on a bile acid replacement, or do they tell you at very minimum, please go on pancreatic enzymes in order to help break down your fats even a little bit. But if you have gotten your gallbladder out, let me know in the comments. Did the doctor ever say you need to be on a bile acid replacement? Because if you didn't, you're going to run into some problems, whether you realize it or not. Okay. So think of this. This is research from coming up to about 6 years ago. And it's called this: cholecystectomy damages aging associated intestinal microbiota construction. Okay. It's a lot of words for saying having your gallbladder removed causes a lot of damage to your microbiome. And here's what they say: the intestinal microbiome is essential in humans to maintain physiological balance and nutrition metabolism. Laparoscopic cholecystectomy, or laparoscopic removal of the gallbladder due to gallstone disease and cholecystitis, or having an inflamed gallbladder, can cause intestinal microbial dysbiosis or abnormal balance, and following bile acid metabolism dysfunction positions the patient at high risk of colorectal cancer. They even say it, high risk of colorectal cancer. Why? We identified aging-associated fecal microbiota in a healthy population, which was lost in cholecystectomy patients or people who had gotten their gallbladder out. Absent intestinal bacteria, such as bacteroids, were negatively related to secondary bile acids and may be a leading cause of colorectal cancer incidence in cholecystectomy patients or people with that who've gotten their gallbladder out. And it's not just one, but it's actually two now. And it's called cholecystectomy. Removal of the gallbladder promotes the development of colorectal cancer by the alteration of bile acid metabolism and the gut microbiota or the gut microbiome. Okay, here's what they say. I'm going to look over my other screen because it's really small. Cholecystectomy is a gold standard procedure for treating symptomatic gallbladder disease and gallstone disease. The rhythm of bile acids entering the intestine is altered after cholecystectomy or removal of the gallbladder, which leads to metabolic disorders. Nonetheless, emerging evidence suggests that cholecystectomy might be associated with development of colorectal cancer, and has been reported that alterations in bile acid metabolism and gut microbiota are the two main reasons. So what does it do? Is now instead of having the gallbladder, you just drip out the stomach with gastrointestinal issues, with diarrhea and things like that. That's why if you see long enough, and you can actually, anal leaking is actually a real thing, and it can cause a lot of problems, especially long term. But it starts to change the microbiome. Okay, now people are going to ask me, um, well, what do you need to do? Do you need probiotics? And it's the question that people ask me all the time. And it's like, if you don't have a good environment, that's like trying to lay down grass seed on concrete. You can lay down the best grass seed, you can water it, you can give it sunlight. But if the soil is not good for it, then it doesn't matter how many probiotics, it's not going to help. That's why I don't give probiotics right away, usually, unless we can do something to massively impact their gastrointestinal system that would help change the environment. So you need a different environment. So when people ask about probiotics, I tell you like this is one of the things that influences the microbiome is actually having enough stomach acid, having enough bile, having enough pancreatic enzymes. All of that flows down and influences the health of the microbiome. You also need you need to have a healthy mucus layer, and you also need it to be not inflamed. And I remember talking to she's a wonderful, wonderful health coach. She's like, man, the gastrointestinal system seems so complicated. I'm like, it's not, if you realize and start understanding principles of it versus trying to memorize what in fact it actually does. But all of those things actually water the microbiome and helps for a healthy microbiome, which does play a role when it comes into colorectal cancer, especially as well. So the biggest thing I'm going to tell you is this: losing your gallbladder was really a liver issue and also a hormone metabolism issue. The gallbladder really was just the symptom. So if you have gotten your gallbladder out, my question is what are you doing about your liver? Because if you got your gallbladder out, there's probably a problem with estrogen metabolism as well. And you probably won't notice that until you hit menopause. Then you're going to have a really, really bad day. So what supplements do you recommend, Dr. Thompson? And if you're watching on YouTube, you'll see I have a big picture of Dr. Oz up here, because Dr. Oz thinks that there's a supplement that's going to fix everything. All right. I think he's done more damage to to people's health than I think that he's even helped. There is no such thing as a magical, recently discovered, fix all my health problems supplement. I will promise you that, guys. There is no such thing as a magical, recently discovered, fix all my problems supplement. And people ask me all the time, and they're going to say, what supplement are you going to do? And I'm like, yeah, we need to look a little bit deeper as well. So stop playing the Dr. Oz game and trying to figure out a bunch of supplements. You need to do things, you need to test properly, and you need to do things in the right order, especially. Okay. Now, I want you to think of this. You can cut out the tongue of a baby to get them to stop crying, but it doesn't address why they were crying in the first place. Okay. Let me say that as well. If you have a crying baby, you can say, oh, I'll just cut out the tongue. That may get them to stop crying over time, but it doesn't address the reason why they were crying in the first place. Just because you can cut out an organ and remove some temporary symptoms doesn't mean that that's the way that you should necessarily be going. So, Dr. Nate, what on earth can I do? So, here's the first thing. Please get tested, okay? I would say you probably need food allergies tested. You probably need at a minimum get your stool tested. And everybody asks, what test would you recommend? And I'm like, it's not the test as much as the doctor behind it who can move you in the right direction. So please work with a Wellness Way doctor. There's so many people who want to get their hormones tested, or they want to get a Dutch test. They get a Dutch test, then they look at it and they're like, oh, I'm so confused. I don't know what to do. Or sometimes they do things even worse. They try to go on 19 different supplements in order to try to somehow manipulate how their hormones are getting metabolized. So get tested. Please, guys, work with a Wellness Way doctor. Please, guys, I would say put your ego to the side and just say, I just need help. I just need help. Please help me go in the right direction. Now, if you've had your gallbladder out, I will tell you this, you probably need to be on a bile acid replacement, also known as ox bile. Okay. You can order that from the Wellness Way store. If you go to the Wellness Way store, you notice they say that it's called Gallbladder Complex or Gallbladder Formula, and need to start taking that. Please make sure that you start taking that. You also may need to be on some pancreatic enzymes. You may also need to be on apple cider vinegar in order to get enough stomach acid up, also known as betaine hydrochloric acid. And then you also need to address the liver, like if you have fatty liver, you have poor estrogen metabolism, or even if you have a thyroid issue as well. Did you know that even if you have a thyroid issue, meaning I have high T4, very low T3, doctors just want to pump me full of thyroid medications, that can be a liver issue. And so if you have a liver or gastrointestinal system issue, you can have very poor conversions of T4 into its active form, T3. The other thing is if you have very poor thyroid function, your body will leave you clues, which is why you may have problems. You'll start seeing some issues with cholesterol metabolism, high triglycerides, things like that, which means, yeah, that's influencing liver metabolism big time. And so especially if people have unresolved thyroid issues that no one has even looked into. So you may need to look into your thyroid as well, okay? So guys, with that, please make sure that you get the proper testing, and please also make sure that you are working with a Wellness Way doctor. And the reason why I say this is like if you're going to take a trip from Chicago to Los Angeles and instead of taking a right-hand turn, you take a left-hand turn, you go in the wrong direction, pretty soon you're going to figure out, I'm going in the right direction. Wrong direction. I need to turn around. And it's like, if you're going from point A to point B, the best direction is in a straight line and not all the way around the world, eventually hoping you end up there in the first place. That's why working with the Wellness Way doctor will save you time, and it will save you money in the long run. And it will save you a lot of unnecessary pain and a lot of unnecessary suffering as well. So make sure, guys, if you are from the Chicagoland area, please make sure that you're getting registered for the inflammation talk, which is Tuesday, February 20th, which is tomorrow at the time of this broadcast at 6:00 p.m. And guys, if you decide that you're going to register for it, the thing that I ask you is please show up. Please be a person of your word and show up, okay? Because we make a lot of preparation for people to be there. And if you don't show up, then I'm like, how much do you really want it? So, and also, if you are not in the Chicagoland area, you can still work with us remotely if you were within the contiguous 48 states. And you can watch the webinar. If you go to the top of the page, you will see how to get registered for that webinar. You can watch it. And at the end of it, you'll see a link to schedule a discovery call with me. So make sure that you do that. I would love to jump on the phone with you in order to hammer some of these things out to help getting you not only to feel better, but maybe even to help you save your gallbladder, or if you've had it out, what you can do in order to preserve your health and make sure that you're restoring your health back to where it's supposed to be as well. Okay. So help, I lost my gallbladder. Well, here's what you do right now. So I hope you guys got tremendous benefit from this. Thank you guys so much for watching this as well. And just remember, just because they cut it out doesn't mean that there's not problems anymore. You can cut out the tongue of a crying baby, but it doesn't solve the reason why they were crying in the first place. So make sure, guys, if you're watching this, please reach out to me. let's see if we can get you moving in the right direction as well. Be well, guys. Be blessed. Give me a topic for next week, by the way. Please give me a topic for next week. I will consider it. I will consider it, guys. So it takes probably 4 to 5 hours in order to be able to make everything, to be able to have these topics. So I appreciate and love all of you guys. I wish you nothing but the best. I wish you health. And also, as I always say, please always remember who you are. All right. We'll see you guys next week.